Normally I like to end with kind of a hands-on presentation. We don't really have that much time for that today, so we'll kind of start with one. So experiential for the entire audience. So turn to the person next to you and greet them in a way, shake their hand, pat them on the back, give them a hug if you feel comfortable. But notice while you're doing this, first, I'll talk about a little bit my path. In college, I became a massage therapist. I was really interested in the healing arts. I was a massage therapist for a while. I knew I wanted to go into the field of medicine, just didn't know where I wanted to end up. I ended up volunteering with a very prominent osteopathic physician. I didn't even know what osteopathic medicine was, and I'll get into that a little bit more in the talk. But since then, after that, I went to an osteopathic medical school and spent all my free time and money on top of medical school, paying for debt in medical school, is studying all the different types of healing arts, spent time with acupuncturists, homeopaths, learning all the different types of hands-on things and how to apply that in a medical model. I did my residency in family medicine here at UCSD, which is almost the complete opposite of what training I had before. I was the first osteopath they accepted in the family medicine program in 17 years, so I don't really know what they knew what to do with me at the time. Through the time I stayed on in his faculty, and then it's been on faculty ever since and been part of this Center for Integrative Medicine here. So it's kind of interesting to see how I started out in one area of medicine and then made a transition to another area, and it's been the bridge to me is the magic place of how we can bridge both of these worlds of medicine. And it's always good to have good balance in your life. We'll be talking more about balance in a little bit. Because this is what manual medicine is. It's about restoring balance within the body. It's a hands-on diagnostic and treatment approach of restoring balance within the entire body system. Many different areas of manual medicine. We're just going to be talking about the ones that we can offer here at UCSD. We don't have time to get into all of them today. There's literally thousands of different techniques that people can learn. A good definition is just manual medicine is the use of hands-on techniques to diagnose and treat dysfunction in the body. So it's simple as that, laying on of hands to diagnose and treat. And one thing I like to point out is the word diagnosis, because it's something that's kind of a lost art. I'll be touching on that in just a little bit, but there's all the treatment techniques, but are we really doing a diagnosis? So just shaking someone's hand, patting them on the back like you just did, you're bringing in information into your own nervous system. You can make diagnoses of that as a practitioner. So why does this work? So there's a somatic experience to all disease processes. So I don't care if it's back pain, you have migraines, you have insomnia, you have reflux, you have hypothyroidism, diabetes. You're going to experience this somehow in your soma. Somehow in your body there's going to be an experience of this disease process. And there's techniques out there that you can use to treat all these different types of somatic experiences. One thing I'm going to spend some time discussing, we're talking about diagnosis and treatment, is palpation and perception. So this palpation is the objective palpatory experience that you have with if you're a practitioner or your physician and the patient. It's the objective ways. Is it when you're touching tissue, is it indurated, is it hard, is it inflamed, is it hot, is it cold? It's the stuff that you can diagnose, write down objectively finding. Perception is your own personal subjective experience of what's going on. So you might find some place that has an area of dysfunction in someone's shoulder, and maybe that place has a little bit more muscle tension in that area. Maybe this person has muscle tension because of stress in their job, or maybe they've been carrying a weight in their body for a long period of time. That's your own perceptive experience. This is what I try to really instill with students. There's a lot of students around the country that rotate in our clinic to discuss about what they experience when they're laying their hands on somebody. So this is what I wanted to talk about as far as when you're diagnosing someone, laying hands on, is that a patient comes to you, you can put your hands on somebody, and to me it's kind of a lost art. Right now we're relying so much on other senses, especially our eyes and our brain, to determine things, because we're reading radiology reports that the radiology read off a screen. We're reading pathology reports that the pathologist read off of slides. We're reading lab report. I train and teach a lot of different medical students, DOs and MDs, and what I've found is MDs have lost the art of how to touch their patient. To me, it's a lost art. We're using our ears sometimes, listening with a stethoscope, but the laying on of hands is a diagnostic tool because every disease process has its own feel. So hypothyroidism has a certain feel to it. Diabetes, when your A1C is elevated, has a certain feel to it. If you have insomnia, that has a certain feel to it in the cranium. So this is what I really try to instill in all students that I come across. A lot of times a patient will come into the clinic and I hide the chart, I hide medications, I hide everything, and I say, go get your hands on the patient, touch them up and down, and then come tell me what you feel is wrong with them. And a lot of times, to the student's surprise, and not to my own, is that they're able to come up with the right answer. They're like, oh, well, this patient might be suffering from some high blood pressure. This patient might be suffering from depression. So it's something that we really try to instill in all these up-and-coming students that are learning this, is get out there, put your hands on people. There's a lot of different information that can come through your fingertips. Your hands are a great diagnostic tool. You can feel the sensation, the touch perception is up to 1/1000th of an inch, which is a lot more sensitive than any touch screen that's out there nowadays. So at the cornerstone of manual medicine is anatomy. So most osteopaths, most physical therapists, massage therapists, they study anatomy. That's one of the first classes that you take. And it becomes the cornerstone for learning how to access different areas of the body through the musculoskeletal system. So knowing a good sense of anatomy is what we want to do, is restore balance. Dan talked about everything's about balance. One way you can think about manual therapy is a restoration of balance, bringing everything into a homeostatic state. So basically our bodies are built for movement. Every single muscle, every single organ, everywhere is built for movement. Our cardiovascular system is built for movement. When it stops moving, we die. Our GI system is built for movement. When it stops moving, we have small bowel obstructions. We need to get things moving again. Our respiratory system is built for movement. Our nervous system, even the central nervous system and the brain and spinal cord, have its own inherent sense of motion that can actually be palpated and taught. Everyone can be taught to feel that. So when you have lack of motion, there's dysfunction. So it's to get things moving. It's what I try to instill in all patients. Movement is key, because motion is lotion and motion is life. There's no mosquito nests that come in, running water. So when you have standing water, that's when disease starts to come. Different ways to restore balance. We're talking about how to bring balance in. I want to try to describe some different models of how manual medicine works. Maybe to see, there's a lot of different research on why it works. Categorized into different areas of models, and try to touch on a few of these just to appease your scientific minds. So biomechanical, a neurological, and an energetic model. So the biomechanical model, if you just look at the structure of the human body, engineering of the human form. So we're all made up of skeletal muscles, ligaments, bones, tissues, and like I said, there's thousands of different techniques you can use to move the arm around in a certain way, to move the spine around in a certain way. But you're not affecting, you can think of the human structure really, if you're a mathematician, it's a fractal composition from the cellular level, microscopic, to the macroscopic level. So you're affecting areas and tissues on the microscopic level. On a cellular level, you're affecting change. And this has been proven, as far as the upregulation of calcium receptors, sodium, potassium pumps, just from different types of different massage techniques. So this is one area, one model that you can think of why manual medicine is working for certain things. Another one is the neurological model. So there's a lot of different areas where you can focus on treatment of the nervous system. So whether that's the brain or all up and down the spinal cord, chiropractors, physical therapists, they know a lot of techniques focusing on the spine and also in the sacrum, so the craniosacral therapists. So there's a balance between the autonomics. Once again, I'm talking about balance here. We got the parasympathetic and the sympathetic divisions of the nervous system. In our society, we live way highly on the sympathetic overdrive. We have emails to answer, we're waking up early, we have to get our exercise in, we have to go to the clinic, we have to come home and exercise again, we have to do this and feed it. So we're on sympathetic overdrive, and we're feeding ourselves coffee and all other things and medications to increase that sympathetic overload. So a lot of times, that's why a lot of people go get massage therapy, because massage, what it does is it calms you down. It increases the parasympathetic drive in the system. everyone tends to love massage because they feel so much relaxed, but really that's probably your natural state. So you leave a massage, you go get a massage and you leave and you're like, oh, I feel so great. But really that's probably what you should be feeling like most of the day. And sometimes, I mean, if you think of it from a neurological evolutionary perspective, I mean, you're walking around, you're, picking fruits and berries and eating the occasional kill that, you brought, and then once in a while you have sympathetic load. Right now we're complete opposite. So a lot of techniques that we use is to restore that balance in people. A lot of patients come to me and I know exactly what their problem is that their sympathetics are way through the roof. Sometimes you can have that in opposite scenarios. I mean, if you just look at this slide, let's see, pointer, red, I don't want to turn it off, okay. Look at the slide. So sometimes you might want to increase sympathetic load. Someone comes in with an acute asthma attack. What do beta agonists do when you're taking a beta agonist inhaler? You're increasing the sympathetic load to increase the amount of air that you can bring into the respiratory system. So there's techniques you can do right in this area to increase sympathetic load that affect the lung. Same thing with the heart. Another model that manual therapists like to wrap their minds around, and really hard to do research in this area, is the energetic model. So they're talking about the vital force. Primary respiratory mechanism is what we call it in osteopathic terminology. The meridians, chi, chakras. It's the palpation of the inherent energetic systems of the body. And you can lay maps over these, and there's a lot of overlap, and there's a lot of overlap between a lot of different cultures as well as practitioners and techniques. One thing that you do need to be careful of if you're working in the energetic field is the transfer of energy from patient to practitioner. You always want to be very mindful of that. I'm going to be talking a little bit about the different types of forms of manual medicine, especially the ones that we're kind of focused on some of these here. So physical therapy, healing touch, massage. What we're going to be doing here at UCSD. So we have osteopathic physicians, and I'm going to get into that in a little bit. Just, I've talked about myself as an osteopath. I'm explain to that just a little bit more. We have a wonderful physical therapy department, both inpatient as well as an outpatient center here at Thornton, as well as Hillcrest. We're going to have massage therapy being done in our clinics, and we have healing touch, and that's going to be incorporated into some of the inpatient programs that we're going to be having. So physical therapy, I'm friends with many different physical therapists in the community, use them quite a bit, and there's a lot of different physical therapists focus on different things. Many different branches, many different techniques. What's great about physical therapists is they have the space to have all the different types of equipment, so they can be tailored for certain things. So there's physical therapists out there just for athletes. There's physical therapists out there that are just for Parkinson's disease. There's physical therapists out there that just deal with car accidents. And they also give you a timeline and goals to meet. Like, okay, I want to be swimming this amount of, this many laps by this day. So they're there as your friend. And I really like physical therapists in the sense that they educate the patients on what to do at home, and they give them homework. And a lot of them are very adamant that they must do their homework. And then patients come and see me, and I was like, well, did you do your homework? And so then we can report back and forth with the physical therapist for all of this. Massage, we'll have some massage therapists here. This is pretty much as old as time. It's Egyptian, it's chronicled in Chinese medicine as well. It's recommended by Hippocrates. He had massage, I think one of his writings said he had got a massage every week to help him deal with his practice load. Sounds like a good goal for me to reach one day. There's many different branches, many different techniques. There's hot stone massage, there's water massage, pretty much anything that you can think of. And it's also practitioner dependent. Healing touch, how many people are here are certified healing touch? So there's national, international foundations. It's compassionate, it's non-invasive, restore harmony, energy, and balance. And it'd be great to walk into a hospital one day and have every single nurse, like in the unit, in the ICU, and have every single nurse doing healing touch as a regular protocol, or part of, like, any surgeon can just write, or anybody can just write healing touch to be done after surgery, post-surgical. I mean, just to be able to see that to be done, that'd be a great goal to reach for one day. It'd be kind of like the ultimate thing to see on the inpatient side. I told you I'd take a quicker look at osteopathic medicine. Osteopathic medicine was founded by a guy by the name of Andrew Taylor Still. He was an MD in the Civil War. He really got tired of the current medical practice because all they did was surgery and drugs. So he thought there must be something better out there. So he started researching what else could be done. And at the time, 2 of his children became sick with meningitis. The drugs and surgery at the time weren't successful, and they ended up succumbing to the disease. And he spent the rest, decade or so just wandering around, and he came across many different healers in the area. One was a man from Japan who had studied with another guy he met, talked about bone setting, and started doing all of these hands-on techniques to help people. He spent a lot of time with Native Americans, so he learned a lot about the living off the land, the nutrition in that sense, and he put together this entire philosophy of medicine and said, I'm going to start a school and start a different type of training in medical school. He came across and he had these 3 tenets, which is basically a philosophy of practicing medicine. So the body is a unit, everything is holistic, the body is self-healing, and structure and function are interrelated. So a lot of times people ask me, what's the difference between a DO and an MD? I'm an osteopath, what's the difference? Do you get to do all those manipulations? Do you get to manipulate your patients all the time? Yeah, that's part of it. We do learn all the hands-on techniques, and most of the hands-on techniques out there have stemmed from this thought from Andrew Taylor Still of osteopathy. Everything has kind of branched from there if you track the history in the United States of manual medicine. But really the difference between a DO and MD is the philosophy. So body is a unit, body is self-healing, structure and function are interrelated. This is taught to us from day 1 in medical school. So we're inundated with this, and this is how we approach our patients. So a lot of times people say, oh, well, there's DOs out there, but they never did anything for my shoulder, never did anything for my knee. That might be true because they're not spending all the time and energy focusing on the manual treatments, or maybe they didn't feel confident enough in their skills in doing that. But a lot of times they approach the patient from a different perspective, from a more holistic perspective. They're looking at everything from the entire holistic point of view. Here's a quote from Andrew Taylor Still: within a man's body, there's a capacity for health. If this capacity is recognized and normalized, disease can be both prevented and treated. So what he's looking for is what makes the person healthy versus focusing on the disease state. So he's looking at the entire being and looking for health. So, and this is in his early writings, and we have some of his earlier books in our clinic, is you can really see this is the first time in the entire Western world, in the Americas, of the incorporation of an Eastern type of philosophy in medicine. So osteopathic medicine today, it's a growing profession. About 10% of all physicians out there. It's the most rapidly growing area in medicine right now. They've opened 7 new medical schools in the last 2 years. The sad part about it is for me, is that of all the osteopaths that graduate, there's only about 10% of us that actually end up using the hands-on techniques. Variety of reasons for that. Sometimes they get wrapped up in the entire medical system, like Dan was talking about, being part of the system, and you just don't have the time or energy or whatever to wherewithal to use these techniques. And some of these techniques take some time to do, so sometimes you're wrapped up seeing 4 or 5 patients an hour and you don't have the time to do that. Most osteopaths have a good affinity for primary care. I chose family medicine just because I enjoyed that aspect of medicine. I have osteopathic friends that are OBGYNs. I have an osteopathic friend who's an orthopedic surgeon. So you could be any different specialty that you want to be. Like I said, most are choosing primary care. We've kind of been recruiting more and more to come for family medicine. Like I said, I was one of the first DOs to come into the family medicine department, and I'm proud to say that this year for our incoming intern class, there's more DO residents than there are MD residents in the family medicine department. So a few of those are really trained and highly skilled, and they're also interested in this area of research. So we're going to see if we can start publishing some research studies over the next couple years here. Some of the different techniques that you can use, and these aren't just osteopathic techniques, just all for manual medicine techniques. So you can be put into 2 different categories. You can have direct techniques or indirect techniques. There's a high velocity, low amplitude. Those are the cracking people are familiar with, muscle energy techniques, ligamentous tension, craniosacral techniques. You can have myofascial release, trigger point release, counter strain, and visceral techniques. Like I said, It's really practitioner dependent. Sometimes some practitioners become very skilled in just one thing, like myofascial release. A massage therapist will build themselves. I'm a myofascial release specialist, and that's exactly what they do. Or I am craniosacral therapist, or I only focus on balance ligament distension, or I only put hot stones on people. So it's all different types of ways of balancing out, restoring balance within the somatic system. When should you not use it? There's some contraindications according to some people, like bone neoplasms. I do consults at the San Diego Cancer Center with Dr. Vicario, but I mean, one you have to be careful with bone metastasis, active joint flare-ups, hypermobile joints, vertebral artery, but I will say that there's no contraindication for touching a patient in a compassionate way. So I don't care how many metastases they have all over their bone or whatever. If you're approaching them with compassion and healing, you're going to do a world of good for both the patient and yourself. Now I'm going to present a little bit more about some of the evidence behind some of this. So the evidence, it's always kind of interesting to me when you kind of look at this research, because the gold standard out there is the placebo-controlled or double-blind placebo-controlled trial for medications. For manual therapy, acupuncture, you might be able to reach that because there are some sham treatments. Manual therapy can never really truly reach that second level of blindness for these trials. So a lot of these are retrospective case studies that you're looking at these clinical correlations. The most studied one out there, if you do research in the literature, is massage therapy. So massage therapy is good for anxiety. Massage therapy is good for people who have depression. I read a study last night. Massage therapy has slowed the progress in dementia in 14 patients in one place. And a lot of this, I mean, it's kind of interesting and sad to me in some respect that we always have to prove to ourselves and to the scientific community, you know, of the exact, whatever's obvious. You know, it should be published in like the Journal of Common Sense. Massage therapy is good for you. You know, holding someone's hand lightens your mood. I find it interesting that we're doing research on this, but the interesting thing about this research, it does, you know, improve your mood. You get a hug from someone and your immune system is actually boosted. They did a study on medical students on, you know, who had massage right before final exams, and their immune system was boosted because it's known medical students always get sick during final exams because the stress decreases their immune system. So I was able to balance that out. One other interesting thing, a patient of mine just did a research study on the 8th floor in Hillcrest, and he brought in chair massage to the nurses there for 3 weeks straight. And so it was both, they were available to all the nurses, only for the nurses. So the nurses got chair massage in the morning shift and in the evening shift. And what they found is that, of course, patient satisfaction scores went up, nurse satisfaction scores went up. But the really interesting finding was that there was a cost-saving benefit for the hospital having the massage therapist there. So all the admin, CEO people in the audience, you pay attention because cost-saving, everyone lightens up about that. But also, the medical error rate went down drastically, almost to zero. So much so that they thought they made an error about that, looking at the medical error rate. So you can imagine what kind of effect that has. And so they haven't really, I don't think the study has been published yet. They're still looking into more things coming on about it, but it's something to look forward to. Some of the stuff that I'll talk about, some studies real quickly. This was a big one that was published in the New England Journal of Medicine, comparison of manual therapy for spinal manipulation versus standard care for low back pain, which basically standard care low back pain. And this study was just treated with NSAIDs. And they found that the people who had increased, or they had spinal manipulation had standard versus standard care had much greater, less use of medications, basically. And so when you look at this, you know, you're getting manipulation versus taking medication. Yeah, you're using medications a little bit less, but what do most people have? What's the greatest, you know, cause for NSAID use is stomach ulcers. People have GI bleeds all the time from this. So this cost-saving measure, it's hard to study that, but you can look at it from that perspective. Other things that I'm interested in besides, you know, back pain, neck pain, hip pain, musculoskeletal pain, that's kind of bread and butter for any osteopath, chiropractor, physical therapy, massage therapy out there. But my interest lies more in all the non-musculoskeletal complaints that people have and how to treat that. So one example is this patient of mine Ulcerative colitis, she refused to take any sort of medications or anything. She just wanted to get some manual therapy for this. We did a couple techniques, visceral techniques around her colon, treated nervous system and the superior inferior mesenteric ganglion. Her ulcerative colitis flare went down. So you can see on lab values, and from February to March, her CRP value went from 16.3 to 2.1. ESR dropped from 95 to 52. And that was after seeing me for twice a week during that time period. Since then, I've been seeing her once every 4 months, and she hasn't had a recurrence of her ulcerative colitis since. Otitis media, this is a big one, especially for people that know about craniosacral techniques, the cranial techniques, temporal bone, otitis media in children. I have a friend who's a pediatrician, she's an osteopath. She had to really dig in her charts to find the number of children in her busy practice that have ever had otitis media. So most osteopaths that are out there who have kids in their practice, and we have a lot in ours, never really have an occurrence of otitis media because you get these temporal bones moving and acts as a pump mechanism to drain out that fluid. We all know a lot of times pediatricians' offices are really jam-packed with kids complaining of ear infections. Here's another example of non-musculoskeletal things is with OB. So if you're treating someone who's pregnant during the time period, you can appreciate the anatomy here. Big area to focus on is the lumbosacral junction. You can get that moving. You can have less complications with delivery. So in this study they did osteopathic treatment was associated lower rates of meconium stain, amniotic fluid, preterm deliveries, and the use of forceps in those deliveries of the pregnant women who were treated with manual techniques during their pregnancy. And neurological system. So I have a good number of patients that have Parkinson's, a lot of other neurological disorders such as spinal cord injuries, traumatic brain injuries, multiple sclerosis. Here's a study that was done with standard osteopathic treatment, significantly improves gait performance in patients with Parkinson's. I've seen a lot of my patients who have Parkinson's, a lot of my patients with multiple sclerosis keep their flare-up of MS and their Parkinson's at bay over time. One thing I'd like to leave you with is healthy lives, healthy bodies. So everyone always asks me, is there something I can be doing at home? And I say, yes, start moving. Because the body is built for movement. Your musculoskeletal system is built for movement. So get up off your chairs, walk around, do something to keep you moving. I don't care if you exercise, you have an exercise or you need to have an exorcism, just get up and start moving because movement is life. Work a lot with nutrition and functional medicine in my practice, do a lot with homeopathy and always testing for vitamins and supplements, but that's a whole nother lecture and other presentations that we can get into later. Hands-on demonstration we'll go through about. So any other questions, you can find me during the break and we can talk more. Thank you very much.